Hi, and welcome back to this Thursday edition of Focal Point on AFR Talk. Brian Fisher is my name. This is Focal Point, the home of muscular Christianity on conservative talk radio. You know, and one of the things that we have been monitoring since day one here on this program is ObamaCare. And the more information we get about ObamaCare, the worse it gets. I'm looking at a story here from the Weekly Standard. Healthcare premiums are going up 125% in Wisconsin due to Obamacare. So day after day after day, I report to you another state where their insurance commissioner reports that insurance premiums are going up through the roof. Obama getting so desperate now, he's actually recruiting NFL teams like the Baltimore Ravens now. Now we're going to be out there hacking and flacking for Obamacare and trying to get people to sign up for these things. Well, somebody who's helped guide us through the thicket of Obamacare has been sort of our guru-s, if I may use that word. Our guru on all things related to Obamacare is Twila Brase. Twila is the president of the Citizens Council for Health Freedom. She's responsible for the Health Freedom Minute here, right here on Focal Point. Twila, welcome back to Focal Point with Brian Fisher.
Thanks so much for having me, Brian.
Well, Twila, I'll tell you what I want to talk to you about. I mean, you know, you just heard, and you're aware, Wisconsin premiums going up. They're going up everywhere. Oregon, they're going up everywhere. Every day is a new state, new spikes in insurance premiums. And specifically what I want to be sure we cover today is that the Citizens Council for Health Freedom, your organization, is leading a refuse to enroll campaign. Refuse to enroll. So you're urging people, just don't even enroll in Obamacare. Don't play this game. Most people don't even know that you can do that. There is a way that people can refuse to enroll. So tell us about that.
Well, we're asking people to refuse to enroll in the Obamacare exchanges. Now, as you know, the law says that you have to be covered either with private insurance or government health plans, or you have to pay this penalty tax if you choose not to, or you could be one of the 9 exemptions. But what we want people to know is you can get insurance outside of the exchanges. The exchanges are the Obamacare implementation centers, and the exchanges will only stay alive if people go in and use them. So that's why it's really important to refuse to enroll through the Obamacare exchanges. So find your insurance elsewhere, pay your penalty tax if you choose to go uninsured, go join a health sharing organization and be one of the 9 exemptions. You know, make your choices, but don't choose to use the exchange, because if the exchange does not have sufficient people in it, it will not have sufficient funds to remain in existence. And the exchange is the centerpiece of Obamacare. Without the exchange, Obamacare cannot move forward. It cannot be implemented. And so it's really important to stop the exchange. So stopping the exchange means that people don't enroll in it.
So they still get insurance because that's what the law is going to require, or you can go without and pay the penalty. So refusing to enroll in the exchanges doesn't exempt you from the mandate. The individual mandate's still there. The employer mandate suspended. The individual mandate is still there. But you don't have to get your insurance through one of these exchanges.
Right.
And tell us just for a second, before we talk about some of these alternatives, I know, you're saying, look, the exchanges are the key to this whole thing. Obamacare doesn't work if the exchanges fall flat. And one of the real problems that is facing the Obamacare rollout is that young people in particular are going to find their health care costs, their premium costs going through the ceiling, and they have minimal health care needs at their stage in life. So they're going to be inclined just not to enroll at all and just pay the penalty. But without the participation of the millennials, I mean, even the Obamacare people are saying, look, if we don't get young people signing up and paying these exorbitant rates to buy insurance that they don't even need, this thing isn't going to make it.
Right. And so, yes, they're targeting the young people, and you'll see the insurance ads everywhere across the country, young people, and they'll be talking about why you can get insurance and how this is coverage and this is safety, and you'll be able to get subsidies in the exchange, so the prices are going to be affordable. But the fact of the matter is, anyone who goes into the exchange is getting a government policy. There is no private insurance in the exchange. It's very much like Medicaid today, where the government has contractors who do the program for the Medicaid or for the state Medicaid agency. And so someone on Medicaid may have a Blue Cross Blue Shield card. They may have an Aetna card, but they are still on a government program. And that is what the exchange is, which is why we say the exchange is Medicaid for the middle class. They are pulling more and more people into government programs. They call it private insurance, but it isn't, because you are filling out a federal application form under penalty of perjury. And so you are applying to the federal government for coverage. And so whether you pay the entire cost, whether you have it subsidized, or whether or not you have traditional Medicaid and you pay nothing, all of it is government health care. This is how they are building the national health care system.
Now, we support I support personally, and we as an organization have sent out a kind of press release in support of the Don't Fund Obamacare campaign being led by Ted Cruz and Mike Lee to just refuse to fund implementation of Obamacare through the continuing resolution. But what I hear you saying, Twila, is that Obamacare, we can stop the implementation of Obamacare. We can bring it to its knees if individuals just don't go through the exchanges to get health insurance. That will stop the thing in its tracks.
Right. There are a variety of ways to stop it. One is, of course, to take away its money. But the other one is to take away the people, because if people refuse to enroll in it, it takes away the money from the exchanges. They cannot function. They cannot fund their operating costs unless there are sufficient numbers of people in there to transfer money from the healthy to the sick and to pay for the operating cost of the exchange, which is huge. It's anywhere from $10 to $100 million a year to fund these exchanges. So just by staying out of the exchanges, maybe choosing for a year, 2 or 3 years to go without insurance and save up your money for your own medical expenses, get a health sharing organization, or buy insurance outside of the exchange. Just don't go into the exchange.
Now, let me ask you this question. Most people, in fact, I got to be honest with you, Twila, until I began to look at your campaign, the Refuse to Enroll campaign, I was under the impression, and I think most Americans are, most Americans are clueless about this. I've got a story here. 44% of Americans don't even know that Obamacare is the law. This thing is a flaming train wreck coming down the rails right at them. They have no idea what's about to hit them. A lot of individuals out there, especially young people, don't even know that they have an obligation to buy insurance or they're going to experience some kind of a penalty. But I was under the impression, I think a lot of people were, that if you didn't have insurance through your employer, the only way you could get it would be through an exchange. Your choice was either to go without or go through exchange. How accessible is, say that somebody wants to buy insurance, but they don't want to go through an exchange, how accessible is insurance outside these exchanges?
Well, unless the private insurance companies decide to totally fold, it will still be accessible. Now, some of the private plans have gone away simply because they did not comply with the Obamacare mandates, but that doesn't mean that there still won't be private individual insurance outside of the exchanges. And as a matter of fact, there are plans who are building their own private exchanges in order to sell to individuals, and they're asking companies, and they're going to companies to try to encourage the companies to send all of their individual workers to these private exchanges. There's nothing wrong with the private exchanges. It's just the Obamacare government exchanges that we're talking about. So
Yeah.
I think the insurers don't want to be just government contractors for Obamacare, so they are trying to keep a private system alive outside of the exchange. So it would be good for everybody to try and make sure that it stays there.
Now, one of the concerns, Twila, has been a concern that you've had in your organization from the very beginning, talking here with Twila Brase, who is the president of the Citizens Council for Health Freedom, has been privacy concerns.
Yes.
And I've gone over with this listening audience the fact that there's this federal data hub. These not volunteers are going to be paid staff, these navigators.
Right.
No background check done on them, but they're going to have access to information from the Social Security database, from the IRS database, from who knows where. Peace Corps, I think, is even on there somewhere.
Yep.
So, and they're not even going to run the final test on the security of this data until September 30th. So right now we have absolutely no assurance that our information, our confidential information, is going to be protected under one of these exchanges. And I'm assuming that's one of the major concerns that you have in encouraging people to think about alternatives.
This is the first time in the history of this country that the federal government will know the insurance status of every individual. They will know whether you're in a health sharing organization, whether you get it through your employer, whether you have it personally, who do you get it from, are your children part of it. This is a huge insurance status tracking system for IRS enforcement. And so we just encourage people not to go on and provide all this information to the federal government. There are parts of it you're not going to get out of because the insurance company and the employer are going to be reporting information to the exchange, but there's no reason that you have to add additional information to it. And of course, as I said, if we can stop the exchanges, we can stop Obamacare, and the exchanges will then fold. So the important is we have a one-page flyer called Refuse to Enroll, and you can go to refusetoenroll.org, that website, refusetoenroll.org, and you can find our one-page flyer and actions to take and the 4 reasons why you shouldn't go into the exchange. And you can use this for friends and neighbors. You can post it. You can, mail it. You can do whatever you want. You can distribute it because this is really a key way to stop Obamacare is by stopping the exchanges, depriving it of enrollees, depriving it of cash.
Got about 30, 45 seconds left. Twila, I know that you went to the Minnesota State Fair last month, 1.7 million people going through there. You had a billboard and a bus shelter campaign pushing the Refuse to Enroll idea, alternatives. What kind of reaction did you get at the Minnesota State Fair?
Well, it's a little hard to tell because the billboard was outside of the gates, and so the whole idea, of course, is just seeing the message and being a counter message, because here in Minnesota we have now buses and billboards and radio and television ads from the MNsure Exchange. So our bus shelter campaign just is up now. We've been getting positive reactions. We've been getting negative reactions from folks who want Obamacare. So it's been kind of interesting. But we have provocative messages that are clean, and we have fresh faces that are, I think, attractive. And so it's been a good campaign.
Twila Brase has been our guest. She's the president of the Citizens Council for Health Freedom. You can get more information by going to cchfreedom.org. Thank you, Twila.
Thank you.